As of July 2024, healthcare workers at Innercare clinics have been involved in an issue with the SEIU-United Healthcare Workers West union over alleged union busting and retaliation. The union claims that Innercare has engaged in illegal harassment and intimidation in an attempt to prevent employees from forming a union. And here to speak with us a little bit more about what's going on is SEIU Press Secretary Renee Saldana. Ms. Saldana, thank you so much for being here with us today.
Hi, Carlos. Thank you for having me.
So tell us a little bit more about what is going on.
Sure, absolutely. So workers at Innercare clinics in the Calexico area, including Brawley and other nearby cities, they faced unprecedented levels of intimidation and harassment while they were trying to form a union at Innercare clinics. Workers at Innercare were trying to form their union to improve their working conditions. And they also felt that improving their working conditions would also help improve patient care for all of the people that they treat and that they serve. And many of these patients at Innercare clinics also, they are lower income patients who are on Medicare or Medi-Cal. So these are really people who are often forgotten by the system or forgotten by other places. So Innercare workers were trying to improve their working conditions to overall improve patient care in the end.
So what working conditions are we talking about here?
We've heard from many Innercare workers that there was a lot of favoritism happening at the clinics. There was often low wages at these clinics. There were many workers who, are the primary income earners in their families and who were just really struggling to get by on the very low wages. $16, $17 an hour is what a lot of these workers were making. They also wanted, better benefits, and they wanted an end to the favoritism at Innercare. They felt like a lot of people weren't getting promotions or could not get promotions or raises because they weren't, the favorites of management at Innercare, or because they weren't, connected with them or friends with the Innercare management. We heard of rampant nepotism and favoritism at Innercare.
So what are we talking about? Caregivers who are the ones that are upset, or what employees at Innercare are the ones that are pushing this cause?
It's been a wide range of workers. This could be, there were medical assistants, licensed vocational nurses, environmental services staff, or housekeeping workers, telehealth workers, people who worked more on a bit on the IT side of things. These were all of the types of workers who keep these Innercare clinics running in all different aspects of patient care.
For how long has this problem been going on?
Many of the workers at Innercare are saying the issues at their clinics were happening for years.
How are the elections, the recent elections, not fair?
Sure. So what was happening at Innercare, in terms of the election is workers, had been trying to organize a clinic or get together to talk about forming a union at Innercare for a while now. But, in June, I believe it was, or sometime in June and July, I can get you exact dates. They filed actually with the National Labor Relations Board to have their official election. Shortly after they filed for their official union election with the National Labor Relations Board, that's when workers started saying that they started seeing this rampant and extreme intimidation and harassment against workers happening at various clinics. This would be things that range from, constantly pulling people off of their work and into one-on-one meetings with management to discourage them from forming the union, to what are known as captive audience meetings, where all workers are forced to go to mandatory meetings where they listen to hired consultants who are anti-union consultants, talk to them about why they should not form a union or discourage them from forming a union. I've heard from workers who were in these meetings that they said there was a lot of misinformation in these meetings, and that when they tried to speak up or raise questions, they were told they couldn't ask questions. They were sometimes told to leave these meetings. A lot of these people, aside from being harassed and intimidated by their management to not support the union, Innercare terminated 10 workers across their clinics. And many of these workers were publicly in support of their union. And this is absolutely outrageous because, to give you an example, we recently organized 5,000 clinics at a healthcare system in 5,000 workers at a healthcare system in San Diego. And while that was a tough fight, nobody was fired during that organizing campaign. On the flip side, at Innercare, they have fired 10 workers on false, or who were involved in the organizing effort or who were in support of the union at Innercare. So this really put a chilling effect amongst staff at Innercare right before the election, because I've heard from workers that they said, we had majority support for the union when we filed for our election, but once people started seeing that other people were getting fired or other people were getting reprimanded, they did not want to support the union anymore.
So what do you hope the outcome in the near future should be?
Innercare workers overall, we see that this election was not fair and free election. Innercare workers, all workers in the United States of America, by law, they are supposed to have free and fair elections. So Innercare workers deserve fair treatment and a free and fair union election instead of being unjustly harassed, intimidated, or fired simply for exercising their legal rights to form this union. We will continue to stand with these workers, and we have filed charges with the National Labor Relations Board to contest this election. We have also filed more than 30 unfair labor practice charges against Innercare with the National Labor Relations Board for the unjust treatments, the harassment, and the intimidation against these workers who are just trying to form their union. And mind you, a lot of these workers are people who, again, I spoke with somebody who was a single mom, and this was her only job, and she was fired by Innercare after they circulated flyers. The workers circulated flyers amongst themselves showing who was in support of the union, and there was pictures of the workers who were in support of the union on this flyer. And this woman said that after she appeared on this flyer and came out one day to support a rally on her lunch break, which is completely legal, she was fired the next day from Innercare, over false, what she thinks are not good reasons. So again, we want these workers to have a free and fair election without any intimidation, harassment, or interference from their employer. So we will continue fighting until these Innercare workers, that they get that free and fair election so that they can continue to try and give the best treatment to these patients in that area who need it.
Any final words that you would like to give?
Just the last thing I want to say is that too many of these workers have been retaliated against, intimidated, and harassed. Innercare needs to respect their decision and stop punishing workers who are just trying to exercise their legally protected rights to form a union. And again, these are workers who are making $16, $17, $18 an hour, who just want to support their families. They just want to serve their patients. And they're dealing with these executives, some of whom are making more than $500,000 a year, who are trying to say that these workers, are asking for too much or should not be able to form their union. And they're intimidating and harassing, these people who are just standing up for their legally protected rights to form a union. This is wrong. It needs to stop. And workers at Innercare and SEIU-UHW will continue fighting to the end for these workers so that they can have a free and fair election without any intimidation or harassment by Innercare. And I just want to say one more thing, is that Innercare is a clinic, or the Innercare system is a system that receives federal and state funds. So a lot of the money that they receive is taxpayer dollars. Some of the money, we know taxpayer dollars should go towards paying for union busting consultants. We have documents that show that Innercare was paying these union busting consultants upwards of $3,500 a day to discourage workers from forming their union. So we just think that's completely wrong. Taxpayer dollars should not go to paying anti-union consultants to discourage workers from exercising their legally protected rights.
Press Secretary for SEIU United Healthcare Workers West, Renee Saldana, thank you so much for joining us.
Thank you, Carlos.